Hello everyone, good day. Today, I want to share a case about using Chinese medicine to treat allergic rhinitis through kidney reinforcement. The patient was a woman in her 40s, diagnosed with allergic rhinitis at the hospital. Her symptoms were constant nasal congestion, clear nasal discharge, and sneezing, especially noticeable during the spring and autumn seasons. She had been suffering from these symptoms for over a decade. Additionally, she experienced chest tightness, shortness of breath, fatigue, and back pain. Her eating and sleeping habits were normal. Bowel movements were regular, but she experienced frequent urination and sometimes could not hold her urine. Her tongue was pale, with a white coating, and her pulse was deep. She had been ill for a long time and visited many hospitals, which was evident from her thick medical record. I looked through it and saw that she had been to several renowned hospitals and doctors. They generally believed her problem was due to lung qi deficiency, so most treatments were focused on reinforcing the lungs. After treatment, she would feel better for a while, but the symptoms always recurred, causing her much distress. Why did many doctors think the patient had lung qi deficiency? There were good reasons for this. Firstly, nasal issues are often related to the lungs. For example, the Yellow Emperor's Classic of Medicine states that lung qi communicates with the nose. Good lung health means the nose can discern smells. Since she had nasal congestion and couldn't smell, it was inferred that there was a problem with her lungs. Why the clear discharge and sneezing? This too could be explained by lung qi deficiency, as the lungs are organs that dislike both cold and heat. In traditional Chinese medicine, the lungs are considered delicate. When lung qi was deficient, any slight environmental change could trigger an immediate reaction, hence the sneezing and clear discharge. Chest tightness, shortness of breath, and fatigue could also be explained by lung qi deficiency. The lungs reside in the chest, so insufficient lung qi could lead to these symptoms. However, the patient also had symptoms like back pain, frequent urination, and inability to hold urine, indicating kidney deficiency. But this seemed unrelated to her allergic rhinitis and was initially overlooked. The pale tongue, white coating, and deep pulse were typical signs of deficiency, further supporting the diagnosis of lung qi deficiency. But why weren't the treatments focused on lung qi deficiency effective? Previous doctors had tried many approaches to reinforce lung qi, but if they had worked, she wouldn't have been sitting here with me then. Where was the problem? It was clear the patient had lung qi deficiency, but there were other issues as well. There were two reasons for her clear nasal discharge. One was exposure to cold wind, which could cause clear discharge and sneezing. However, it was abnormal for this to happen frequently since we're not always exposed to cold wind. Traditional Chinese medicine considers such persistent clear discharge as indicative of internal cold dampness, a problem with the kidneys. The kidneys are like a furnace for the body's yang energy. When kidney yang was deficient, it could not warm the organs, making the lungs vulnerable to external pathogens. The classical Huangdi Nei Jing also says, for diseases of the five qi, the kidney is responsible for sneezing. Was there evidence for this? Let's revisit the patient's symptoms. She had back pain, frequent urination, and urinary incontinence, typical signs of kidney deficiency. Previous doctors might have noticed this but probably didn't connect kidney qi deficiency with lung qi deficiency for a comprehensive analysis. As we've often said, using the simplest storyline to connect all dots is crucial. Now, with kidney deficiency as our key, we could link all her issues and identify the root cause. The treatment was actually quite simple, using commonly prescribed Jin Kuei Shen Qi Wan for kidney reinforcement, supplemented with acupuncture. I chose acupoints like Yin Tang, Yingxiang, Bidong, Taishi, and Shenshu. There were some changes in prescription and acupoints during treatment, but the overall direction remained the same. After about 2 months of this approach, her condition improved significantly. So, although the patient's issue was with her nose, the treatment focused on the kidneys. In traditional Chinese medicine, it's crucial to view and analyze the patient holistically for effective treatment. That's all I want to share today. Goodbye.